Hello everyone, I am Tasneem and today we are with Dr. Hemant. We will talk about recent advancement in knee replacement. So let us hear it from Dr. Hemant.
Hi everyone, I'm Dr. Hemant and I'm a specialist in robotic and computer navigated hip and knee replacement surgery. I work in Gurgaon and W. Pratiksha Hospital.
So doctor, what are the recent advances in knee joint replacement?
See, we have been doing this surgery for a long time, almost 2 to 3 decades. And we all know that now we have got excellent implants, no matter whatever company is making these implants. All these implants are certified, they are on joint registries, and they have proven the test of time. But still, we find that there is a need to further improve the feeling which a patient gets after a knee replacement surgery, the satisfaction, the overall satisfaction of the patient. And here comes the role of robotic surgery, which is different from a conventional surgery as well as a computer navigated surgery, which we have been doing it for almost now a decade.
That was informative. So, doctor, tell us, what is the patient satisfaction rate? Everyone says it is a successful operation. So, can you please tell us the satisfaction rate?
So, that's a very good question. As I said, we have so new technology, we have better patient care, we have ability to manage the complications better, but you'll be surprised to know that only 80% of the patients are satisfied. The whole race is to get us up by this 20%. What should we do that in knee replacement surgery, our patients are more happier, and after the surgery, they feel that this knee is quite like a natural knee. Mm-hmm. And here comes the role of robotic knee surgery. So whenever we measure the patient satisfaction rate, we have to have a score. So we have forgotten knee score, Oxford knee scores, and we check before and after the surgery if the scores have improved or not. And we have managed to push it up to 89% using the newer technology, functional knee alignment using a Mako, which is a striker robotic system. Now that's a new word. Many doctors also need to read about it, to understand more about it. This is the only robot which takes into account the soft tissues. So knee joint is not just made up of bones, there are soft tissues, ligaments on the either side. And more we release the ligaments, more pain patients are having. With the use of the robot, we do not need to do an unnecessary release. And just imagine if I'm doing a minimum dissection, minimum releases, there is less bleeding, less pain, and we are able to balance the knee of the patient according to the pre-surgery alignment of the knee. And that does make our patients much more happier. You don't need many people. It's very difficult to get a manpower. With the robot, I only need a person called a product specialist who's behind the screen, a scrub nurse, and myself. The retraction is done by the robot. The cuts are so precise. There is a misconception. People feel that robot is only about precision. It just cuts it very, very precise. If that's the case, then computer should have given us a very good results. But robot also takes into account the soft tissues. So we balance according to the patient's knee. So no knee is same. So your knee may be different, other person's knee is different. So with the use of a CT scan before the surgery, we can predict what is going to be the outcome of my patient even before I have started the surgery. That's the beauty. Just imagine when I know that my result is going to be predictable, how my patient's X-ray is going to look after the surgery, from where and what, and how much I have to cut, and what ligaments to be balanced. No soft tissue releases, smaller cuts, no stitches. We use skin glue these days. So all these factors have improved the patient satisfaction from 80 to 89%. We are still not perfect, but that's definitely 10% better than what it was before.
Oh, wow. So doctor, tell us, why do you think there is a need for newer technology and technique?
Exactly, as I answered in the previous question, improving the satisfaction from 80 to as close to the 100. And that's the reason why we are doing research, more and more research, what makes our patients more happier. It's very important to talk to the patient what their goals are. For some people, the goal is simple pain relief, improving mobility and quality of life, which is actually the goal of a knee replacement. And if you do not counsel your patient, and according to patient, they feel they should be able to perform prayers, they should be able to sit down on the ground with a cross-legged and a sit and squatted position, they will be unsatisfied. Mm-hmm. You'll be surprised that patients get unsatisfied if food is not good, if the parking facility is not good, if the hospital is not clean, if the doctor is not polite, if the doctor is not communicating well. So it's not just about the technology. Yes, technology plus the other factors which are not seen and not taken care of.
Right. So, doctor, the knee replacement is a very sensitive. The knee is a very sensitive area of the body, right? So then, how do you counsel your patients before the surgery?
So, whenever a patient is for knee replacement surgery, after doing all the tests, examination, and seeing that we are safe to perform the knee replacement surgery, we have to tell them that this is an operation. A lot of people think that we cut the whole knee joint above and below. I tell them it's just like a sole of the shoe. When it is worn out, we just change the sole part. Similarly, the worn out end of the knee is prepared to give a particular shape according to the implant design. Here comes the robot. We balance the ligaments. Here comes the role of the robot. And fix the implant to the bone with the use of a special cement. They should not forget that there should be three main goals: pain relief, improving the quality of life, and mobility. Rest all are secondary. And do not compare yourself with other person's knee. Comparison is always bad. In fact, I tell them, don't compare the right knee to the left knee because both the knees are different. God has not made our knees and hands exactly a mirror image of each other. So I do tell them that there are certain risks and complications, but there's a difference between a mistake and a complication. Like the commonest example I give them is if I'm driving a car without a seat belt, going at a speed which is over the limit and going on the wrong side, if I have an accident, there are high chances I'm going to injure myself as well as the other person. But if you are taking all the precautions, then the risks are minimized. Mm-hmm. A lot of people have accidents while driving the car. We still don't leave driving. We know it is a good means of going from place A to B. It does provide us comfort. And similarly, patients should understand if you have taken all precautions, done all the tests before the surgery, counsel them well, we can have a predictable result in pain relief.
Wow, that was quite an information. So, doctor, one last question. I'm being very blunt to you, but I really want to know that, is there any life-threatening complications?
No surgery is without a complication. No matter whichever part of the country, whichever part of the world the operation is being performed. We are all here to minimize the risks and to avoid them. Three complications from which orthopedic surgeon is very scared of is an infection. Now you'll be surprised that the percentage of people getting infection everywhere in the world, acceptable limit is only less than 1%. So if somebody is performing 1,000 knees, you can imagine 1% of 1,000 is a normal figure. If someone performs only 10 knees, it's going to be probably negligible for him. So the high volume surgeons have higher patients having the problem. The second complication is a clot in the legs. And after the COVID virus, we have found that a lot of people are prone to get clot in the legs and the lungs. So how do we prevent them? So here comes again the role of newer technology. We want them to be mobilized same day after the surgery. We want them to drink a lot of water so that the blood is not thick. We provide them calf pumps which keep on pumping the muscles of the calf so that the blood flows from the calf to the heart. We give them blood thinners. Now, despite this, if a clot occurs, it is generally not fatal. But rarely, the incidence is very less. The clot from the legs can go to the lungs. Now, that can be life-threatening and we are always scared of. That's why we keep on checking the saturation, the breathing, any chest pain and things like that. If we have taken all the precautions, including the blood thinners and the mechanical pumps, then this is also minimal. But there are many patients who have suffered this complication, who have come out well, and there are others who have ended up with life-threatening problems also.
So that was Dr. Hemant Sharma. Thank you so much, Dr. Hemant. And that was all from him. And watch out for next time about hip replacement and recent advancements. Thank you, everyone. Have a good day.
Thank you.